You want to fix your teeth. You want to stop covering your mouth when you laugh in group photos. But the second you explore a smile makeover, a specific anxiety sets in. You're caught between the desire for confidence and the fear of a fake look, intense pain, or overpaying for the result. Right on cue, your feed floods with ads promising full mouth makeovers for $500, or Snap-on veneers claiming a perfect smile for the price of shoes. Transforming the shape and color of your teeth is a medical intervention that permanently alters your biology. Unlike a superficial cosmetic product, these restorations are bonded to your living tissue, making the procedure essentially irreversible. Aggressively chasing the lowest upfront sticker price carries significant medical risks. When budget dentistry fails, the subsequent cost to surgically treat infections and rebuild the smile far exceeds the initial savings. This chart maps upfront cost against long-term biological health. The bargain trajectory plummets into the negative health zone, triggering secondary expenses like root canals or total replacement. By contrast, a measured premium investment maintains stability deep into its second decade. A successful dental makeover is defined by the long-term biological return on the investment, rather than the lowest possible entry price. Selecting the right biomaterial is the most important financial allocation of your entire treatment budget. Direct chairside composite resin is the most conservative and budget-friendly choice. It is masterfully sculpted onto your teeth in a single session, and typically requires little to no removal of your natural enamel. However, composite has a shorter lifespan of about 5 to 7 years. Its microscopic structure is more porous than ceramic, meaning it will gradually absorb stains from coffee, tea, or tobacco over time. For those seeking maximum realism, lithium disilicate, commonly known as Emax porcelain, is the current global gold standard for front teeth restorations. Emax achieves biomimicry by imitating the subtle, bluish-gray translucency of natural enamel. Because it features a high-gloss glass glaze, it is also exceptionally resistant to permanent staining. Choosing Emax requires a higher financial commitment and a multi-week timeline. Each unit must be custom-crafted in a specialized laboratory by a master dental ceramist. If you are a heavy teeth grinder or need to mask a darkened root canal tooth, monolithic zirconia is the ultra-durable, near-indestructible alternative. The primary risk with zirconia is its density. Because the material is naturally opaque, it can appear blocky or fake if a specialist does not meticulously hand-layer it to add depth. This matrix shows the direct trade-offs for each material. Composite offers the lowest cost and best reversibility, while Emax provides the highest aesthetic translucency, and zirconia leads in pure structural durability. Success depends on selecting the specific material that matches your budget, your aesthetic goals, and the mechanical forces of your bite. To find the highest level of clinical precision, patients often look to medical hubs like Muscat. The capital city houses the region's most advanced digital dental laboratories and hyper-precise robotic milling machines. The premium journey begins with digital smile design. Specialists use Ultra HD videography and AI software to analyze your facial dynamics, replacing archaic, gag-inducing molding pastes with 3D intraoral scanners. This technology allows you to wear a physical mock-up of your proposed smile. You can test drive the look and feel of the new teeth in your daily life before any permanent changes are made. During the ultra-minimal prep phase, the dentist removes only a microscopic layer of enamel, averaging 0.2 millimeters. This ensures the final porcelain looks natural and slim, rather than bulky. Modern computerized anesthesia systems precisely control the temperature and flow rate of the numbing fluid. This makes the injection and preparation phase genuinely, astonishingly painless. Even with these advanced tools, the preparation phase is an irreversible alteration to your natural tooth structure. Investing in this level of digital technology provides the predictability and pain management needed to prevent medical surprises and ensure a safe outcome. Bargain hunting in cosmetic dentistry often leads patients to underqualified general practitioners who lack postgraduate training in complex aesthetic cases. Inexperienced practitioners may aggressively overshave the teeth, stripping away the enamel and exposing the sensitive dentin. This leads to permanent nerve damage and the eventual need for multiple root canals. You must also evaluate margin adaptation, the quality of the seal where the veneer meets the gum line. Cheaply manufactured veneers often leave a microscopic gap at this critical junction. A poor seal traps food and bacteria, leading directly to bad breath, bleeding gum inflammation, and irreversible bone loss. By contrast, a high-end application ensures the veneer sits perfectly flush. This maintains pink aesthetics, keeping the gums firm, healthy, and a natural pale pink. When reviewing a clinic's portfolio, look for custom tooth shapes and dynamic translucency. Avoid providers whose after photos show identical, bulky, bleach-white teeth that ignore the patient's unique facial structure. Vetting a provider's postgraduate credentials and analyzing their before and after cases for gum health is the only way to avoid a permanent medical disaster. To choose your specific path, follow this decision tree. If you're focused on budget or correcting minor gaps, the direct composite path offers speed and reversibility, provided you commit to a strict professional repolishing schedule. High-stakes professionals seeking a decade or more of flawless realism should follow the Emax porcelain branch. In Muscat, a full-mouth investment typically ranges from 1,000 to over 3,500 Omani Rials. Heavy grinders or patients with severely damaged teeth require the zirconia branch. Success here requires finding a clinic with a master ceramist who can overcome the material's natural opacity. While smaller regional cities may offer lower prices, the capital provides a guarantee of international sterilization protocols and authentic, globally recognized material brands. Aligning your biological reality with the correct material is the only way to ensure your investment produces a high-value, lasting result. Even the most expensive medical ceramics are not indestructible. Their longevity depends entirely on your daily maintenance habits. You must exclusively use non-abrasive gel toothpastes. Gritty toothpastes create micro-scratches on the protective ceramic rays, which eventually ruins the shine and turns the veneer into a magnet for stains. Daily flossing is a clinical requirement. While the veneer itself cannot rot, the living tooth and gum tissue surrounding it are still vulnerable to bacterial decay. If you grind your teeth at night, you must wear a custom-fabricated hard acrylic night guard. This device dissipates the destructive pressure that would otherwise crack or fracture the porcelain. Your new teeth are tools for chewing, not for opening packages or biting nails. Mechanical trauma from these habits is the leading cause of premature veneer failure. The enduring quality of a Hollywood smile comes from a disciplined partnership between a specialist's clinical skill and your own respect for your biology.